Ambrosia Cosmetic Surgery in Hyderabad. www.ambrosiaclinic.com.
Most common type of baldness in men is male pattern baldness. Hair loss may start in late teens. Hairline begins to recede. Forehead becomes broader. Hair on the top of the head starts thinning, and bald patch may appear on the back of the head. Male pattern baldness is also called androgenetic alopecia. Hair loss pattern is often genetic, and hair fall happens because of increased sensitivity of hair to natural male hormone, androgens. Other factors like pollution, stress, and insufficient nutrition also play an important role. Hair transplant surgery can grow natural and permanent hair in the bald and thinning areas of scalp. A strip of hair on the side and back of the head is always preserved in most cases of baldness. These hair are permanent and they never fall. This area of scalp is called donor area. In hair transplantation surgery, your own hair is removed from donor area on back and transplanted in the bald area in front. Since hair is your own, it looks natural, grows, and needs haircut as well. Transplanted hair is permanent, just like donor hair. There are about 100,000 to 150,000 hair follicles in the scalp. These hair follicles are arranged in groups of 1, 2, 3, or 4 hair called follicular units. Modern hair transplant method of follicular unit transplantation (FUT) involves dissecting out intact follicular units as they are found naturally on scalp and implanting them in bald scalp. FUT gives most natural results with least damage to the follicles. Hair transplantation involves 2 surgical steps performed in single sitting. First step is obtaining the follicular units from the donor area, and second one is implantation of the grafts in the recipient bald area. Entire surgery is done under local anesthesia and takes 4 to 6 hours to perform. After cleaning, local anesthesia injections are given in donor area. Hair follicles are removed from donor area in form of a strip of hair. The length and width of the strip depends on how many hair is required from transplantation. After removal of strip, the edges of the scalp are approximated with absorbable stitches in such a way that there is no gap in the hair. Head is not shaved and back of your head looks same as before. The strip of hair is then dissected under microscope and individual follicular units are obtained. The follicular units are transplanted into recipient area. Local anesthesia is used and tiny holes are created with needles or minute blades, and the follicular unit grafts are implanted into the holes individually. We take extra care to implant the grafts close together. The natural direction of hair is kept in mind. Single hair units are implanted at the hairline for most natural and fine look. Bigger sized follicular units are implanted behind the hairline and on top of the head to give maximum density. Transplanted hair is very short and looks like dots or crust initially. Hair can be shampooed next day after surgery. You can go to work or travel, though there might be mild swelling of upper space. The transplanted hair falls off, but the root stays inside. After 4 to 5 months, the new hair starts growing. From then, it grows at a natural rate and becomes thicker. Final result can be seen 8 to 12 months after hair transplantation. When bald area is extensive, hair transplantation procedure may be planned in 2 sittings with a gap of 8 to 12 months.
Ambrosia Cosmetic Surgery in Hyderabad. www.ambrosiaclinic.com